It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone. Welcome again to another live round, Katz's Corner, here on WABC Radio in New York. We are live at 1-800-848-WABC. It's 1-800-848-9222. The meteorologists got it wrong. It was supposed to be so sunny this weekend. So rainy and cold. How could they get it so wrong, Philippa? Good morning. How are you?
You wouldn't do too well in the UK with all that rain, would you, Aaron?
No. I mean, I work all week. I don't go outside. I get up so early. It's dark when I come home, dark when I get up, and now it's raining all weekend.
Hang on, I'm just going to get my violin out.
Oh, please. All right, fine, I'll take it.
Well, I was going to moan that, unfortunately, we haven't won the lottery, because apparently, according to Scott Salado, the winning ticket is in Florida, so we'll be back in work tomorrow morning.
And even if you did win the $590 million, you would have shown up to work on Monday, right? I mean, your life wouldn't change, right?
Is that right? Like you would have done, would you?
I would be there. I would just reduce my hours.
How loyal. How loyal.
You'd have to work. I mean, how could you not work, right?
Oh, I could find plenty of things to do.
I'm sure you could.
Absolutely. Work-life balance would switch in a very different direction, I can tell you.
Yeah. Well, I don't know. I don't know how they got it. I mean, it was really because I was so excited on Friday. They said sunny, beautiful. It's going to be great. So
hopefully it's coming. Hopefully.
Well, we want to remind everyone, good morning, everyone, and we're hoping that you can be with us it's going to be I have a projection, it's going to be a beautiful day on June 15th when we're all at the Garden City Hotel for our Men's Health Seminar. There's going to be great spirit there, and there's going to be great lectures and wonderful people. In fact, so many people are now signing up from throughout the United States. Well, I know your dad's coming from the UK, so we can say it's an international meeting, right?
Absolutely.
That'll be nice.
Absolutely. And your dad's coming from Florida.
And my mom.
Oh, wow.
Oh,
excellent.
Yeah, they'll both be there. And I may even have one of my boys there, stand and work the booth a little bit. There'll be a lot of booths, a lot of vendors, and a great opportunity for all of us to get together and learn and greet and make new friends. And men's health is so important, and it's gaining a lot of interest. In fact, we were at the AUA, and we went to the first International Men's Health Society, which is run by one of our friends, Dr. Ridwan Chapsik, and there was great interest there. So, and you'll be talking, Philippa, at the seminar about the new guidelines of PSA and all the derivatives of PSA, right?
That's right. The commonest questions we get asked on the show are issues related to PSA and also to testosterone therapy. There's a lot of interest in both of those individually, and also a lot of questions that come in about whether testosterone therapy is good or bad for you in relation to prostate health. So we'll be discussing all that. And as you know, we spend a huge amount of the year raising money to put on this seminar. So thank you to all those people that have supported us. So if you would like to come and join us, Men's Health Seminar, you can register online at menshealthseminar.com, and it's actually very easy to get to the Garden City Hotel. There's a train stop right over the road, and for those that are not on the internet, you can register by calling Joanne, who's been helping us every year at the seminar, 516-663-9615. If you call Joanne on 516-663-9615, she'll help you register for your place. You do need to register because we're limited to the number of people that we can accommodate, and obviously the caterers need to know who's coming. They do a fantastic lunch, so come and join us. And you're going to be talking about cryotherapy?
Yeah, I'll be talking about cryo, which is a therapy that I use every week. In fact, I did 4 patients. We had 4 this week on Thursday. Patients, some of them were patients that had come to us because they had a return of the cancer after radiotherapy. But some of the patients are found to have prostate cancer that are great candidates for active surveillance, but want some type of minimal therapy, and we can do a focal ablation where we can just place a needle into the prostate and freeze that area of cancer. It's outpatient procedure. All the patients go home, and it takes about an hour, covered by insurance, and I'll be talking about that in my experience. I've done over 2,000 patients, and it's a wonderful center that we have now at Winthrop, where patients can come in. It's very friendly. The nurses are terrific. You've seen the center, Philippa. You've worked there as well, and you know the care that the nurses and the staff give to the patients. The patient satisfaction is extremely high. So I'll be talking about that, and then, as you mentioned, we'll have lectures on testosterone, and then we're going to move in the afternoon, and we'll have some lectures about sleep deprivation and how you can manage your sleep. We'll have an expert there. We'll have a cardiologist talk about cardiac health, bone health from one of our orthopedic surgeons. So I think it's going to be a wonderful day, and we hope to see you. It'll be a month from now, right? We're just 1 month away on June 15th. So again, as Philippa mentioned, it's menshealthseminar.com. And the number again is 516-663-9615.
You know, one of the things I like most about the seminar is that here we are every week on the radio, and people call in. They have a few seconds to ask us a question. So if you have a call this morning, 1-800-848-9222, give us a call. Dr. Katz and I are both live in the studio. If you've got a question about PSA, prostate issues, testosterone issues, pick up the phone, 1-800-848-9222. But the great thing about the seminar is when the patients go to the microphone themselves and take control and ask us questions, put us on the spot and give us their scenarios. And it's a great educational experience, isn't it?
It is. And they're not limited by the time. I mean, here when you call, I guess we're a little bit rushed because it's only a half an hour show, but they will be there the whole day so you can pick our brain. And we look forward to seeing you there.
Great.
Yeah. So what else is in the news today, Philippa? We don't have any guests in the studio. It's just you and I alone with all of you listeners out there about your prostate or men's health or any questions you may have at 1-800-848-9222.
Great.
Yeah. I mean, so was there any other updates that you wanted to fill us in on?
Well, just a very busy week in the office, seeing lots of patients with prostate issues, but very varied week for me. I've seen a number of patients with kidney stones. I actually had a lady earlier in the week who had recurrent urinary tract infections and was quite surprised actually to find that when I looked inside her bladder, she had a bladder tumour. That was quite a surprise, not expecting to find that. Luckily, it was superficial, and so it's going to be easy to remove that and treat that. So
she came in and she just had, what were her symptoms?
Well, it was amazing. She'd had symptoms of recurrent urinary tract infections for a number of months. She'd seen another urologist. She'd also had some lower pelvic pressure symptoms, but nothing really specific that would make you think about bladder cancer. She hadn't really had symptoms of blood in the urine, although on the dipstick, on the urinalysis test, there was blood to detect, but not to actually see with the naked eye.
And did she have a smoking history?
No, she didn't, surprisingly.
So what made you think, it's phenomenal that you picked up a bladder tumor, but what made you think to look in her bladder? Just she had a lot of symptoms, a lot of frequency, urgency, things like that?
Yeah, well, actually, we'd postponed the telescope test because she'd had a recent infection and we were waiting for that to clear. She'd also had a CAT scan that had eliminated any kidney stones, so I was surprised that she was having so many infections without any obvious cause. And actually in women you can often see that the triangle at the base of the bladder can be affected by hormonal problems in women around the menopause, and I wondered whether that might be an issue. So we looked inside the bladder and it was a surprise for both of us, but we have a plan to remove this tumour, and hopefully she'll be absolutely fine. But in the middle of a busy clinic, it takes some time, and her husband was in the waiting room.
I mean, here you are, you think you just have a urinary tract infection, you look inside, and then you found to have bladder cancer.
That's right.
And most of these polyps or growths in the bladder are some form, usually about 90% are cancer, but as you mentioned, you can just kind of remove it under anesthesia, and that's maybe all she might need. You may need to put a little medicine in the bladder, though, right?
That's right.
Yeah. So, well, good job on that.
That's right.
Yeah. And I'm sure that took quite a while because, patients are scheduled and they're scheduled to see us, every, 15, 20 minutes, half hour, whatever. But you get somebody like this that has a new diagnosis of cancer that they weren't expecting, and, that you need to take time. And I know that you did with that.
Well, also, it's great that you can actually show patients a picture of what they see, because in this particular case, it was really helpful for her to see on the screen what I'd seen, because when she went into the waiting room, she said to her husband, he said, "Are you really sure that that's what they found?" And she said, "Absolutely, I could see with my own eye." And even though she'd obviously never seen inside a bladder before, there was absolutely no question that what we saw was not meant to be there. And it was very helpful to be able to have that picture and
I mean, when you see it, there's no doubt about it. And it's unlike the colonoscopy where, with the colonoscopy, you're on your side and you're also sedated. You're not really watching the screen. But here, we give you a little local anesthetic in the urethra, and I do this as well with my men. And, you can really, just watch on this telescope, because we have this digital, cystoscopes, or use a telescope examination, and you can see, and it's pretty clear.
Also, it reminds me how many urological problems we see are related to the environment. It's very easy to assume that, as you get older, it's just one of these things that you get bladder cancer or kidney stones or prostate cancer, but all of those are related to things that the patient does. We know that bladder cancer is very much related to smoking history. We're always talking on the show about the dietary effects of prostate cancer and what you can do, how you can change your diet to prevent prostate cancer. And kidney stones, so common to be related to what you eat. Bad diet is associated with kidney stones. And, we need to remember that when we're seeing patients, that we must spend some time educating them about why these medical problems arise, what the patient can do to prevent them from happening. And education is so much part of preventing recurrences of all these problems.
Yeah, a whole holistic approach, right? And a holistic attitude, that it's not just, oh, you've got a kidney stone, we're going to remove it. But why did you get that kidney stone? Or why did this woman have a bladder cancer? I mean, it could be not that she wasn't a smoker, but it could be just chronic infections, right? That could cause inflammation, because we've talked a lot about inflammation here on the show, that inflammation of the bladder lining from chronic urinary tract infections may have caused this cancer in her bladder.
That's right. And as you know, we've had 2 visiting medical students from the UK, and they were saying to me over the weekend that prevention is something that's still very badly taught in medical schools. We're always talking about how we treat disease, but we're very poor at educating patients about prevention.
Yeah.
And, as you know, all of that prevention education takes time, and we must remember to give the patients the time.
Yeah, I actually gave a lecture this week at Cornell on Thursday night to the prostate cancer support group, us too, and all about, all the holistic things that we use in our practice. And one of the students, she came to the lecture, and I think, what did she tell you when she came back? She was astonished. I mean, they don't teach anything about nutrition, as they don't, as much here in the United States. But I think she was pretty much surprised by all of the information and the approach, the holistic approach that we have for our patients on surveillance.
Well, I found out about it a few days later, because she'd actually been out for a few gin and tonics the first night. So you told me
she's having quite a good time here, isn't she?
Having a very good time. But yes, and she was very surprised about how many of these dietary issues are related to prostate cancer.
Yeah.
And that's definitely something that was a new experience for me when I came to the United States, learning about the foods that can drive prostate cancer, and more research coming out to support the use of vitamin D for prostate cancer prevention, and all the other things that we've talked about on the show related to prostate health.
And we'll have a whole session on that at our seminar. And if you're just tuning in, we are encouraging everyone to sign up at menshealthseminar.com. It'll be June 15th at the beautiful Garden City Hotel. It's 7:17 in the morning on Katz's Corner. We'll take a few phone calls. We have, I know, Harry from Brooklyn has been waiting. Good morning, Harry. How are you?
Good morning. I was wondering, how safe are these advertised things on the radio for ED and testosterone? How effective and safe are they?
Yeah, that's a very good question, because you tune on to the radio, and I listen to Imus every morning as I'm driving in, and he's doing a lot of advertisements. And I guess people think, is he taking these things, and which he's not. I know because I take care of him, and he's not. But there are a lot of people that sign up, and they don't know what their testosterone levels are, but they hear the ad saying it's going to help them, give them more energy, and help them with their sex life. Have you come across this as well in your practice, Philip?
Sure. You get asked about this a lot. And in fact, Brett Mellinger, who's a urologist, a colleague of ours who talks a lot about erectile dysfunction, he raised this issue in his seminar on the urology for the primary care physicians about how so many of these products are on the radio and you see them in Men's Health magazines. And that reminds me to mention that Dr. Mellinger is speaking at the Prostate Cancer Education Series support group. So he will be talking on the 12th of June from 6:30 to 7:30, and then the support group occurs after that. So if you want more information, the Winthrop Wellness Pavilion at 1300 Franklin Avenue will be supporting that, and you can go on to winthrop.org for further information. But yeah, it's a real common problem. I think you have to be very careful about what you buy over the internet, about what you buy in these Men's Health magazines, because many of them are not regulated, as you know. Yeah,
I would say, Harry, have you tried any of these products?
No.
Yeah, I would definitely tell you not to do it, especially if you have a prostate issue. You don't know what you're getting. You don't know the dose that you're getting. And there have been patients that have taken too much testosterone. And you think, well, that's not a bad thing. Well, actually, it can be a bad thing, and it can flare up your prostate. If you have an underlying prostate cancer, it can make it worse, and we discourage it. In terms of the over-the-counter herbal therapies for urinary symptoms, I don't think that there's anything too bad about them, although that may not help you. And again, if you're having urinary symptoms, you do need to be under the advisement and the care of a urologist. You just heard Philippa talking about a woman that came in and had a lot of urinary symptoms and was found to have a bladder cancer. If she had just taken one of these over-counter remedies, who knows what could have happened to her. So I think it's wrong that people just, think that they're going to just do this on their own. I think you need to be under the care of a urologist. And then if you're just found to have, let's say, a mild prostate condition, some herbal therapies can be helpful for you.
That's right. And in fact, it was only a few weeks ago that a gentleman came in thinking that he had symptoms of low testosterone. And actually, I did some blood work on him, and he had an underactive thyroid that had been missed. So if he'd have just taken over-the-counter remedies, his underactive thyroid problem would have been missed. Also, as we've talked about, many of these issues related to testosterone deficiency are related to other medical problems. So it's important that, your blood pressure is checked. We've talked about PSA, that your diabetes screen has been done. All of these are just basic health problems that so often are missed, and just very simple, either urine tests or blood tests in the office as part of the Men's Health screener is important. And the American Urology Association now has a table on their website per decade of life that tells you the tests that you should be having, the screening tests for Men's Health that should be done per decade of life. And you can go and look at that. And it said if you're between the ages of 50 and 60, these are the screening tests that you should have, or if you're between 60 and 70. And that's a very useful guide, not just for patients.
What's the website for that? Do you know?
It's auanet.org.
Yeah, auanet.org. And that's the American Urological Association's website, and that's a very good point, because these things change all the time. We just came back from the AUA a few weeks ago, and they changed the guidelines now, at least the AUA guidelines, which, the U.S. task force had said no PSA screening, and now the AUA says yes PSA screening, but starting at the age of 55 for the average risk guy. But what about, and what about all the other tests, like you're saying, when should you get your sugar checked? What about your cholesterol? How often should you get it checked? And I think that's important. Decade by decade, things do change.
Yes, and I think it was good to hear that there's a move towards urologists not just focusing on the urological issues of the guy that's sat in front of them, but that we remember that there's a big picture there, that we have to think about other factors that can affect health. And certainly when I see patients over 50, I do routinely ask them now, have you had a screening colonoscopy, and try and raise awareness about colon health, urological health, look at the blood pressure, look at their sugars, and all of these things tie in together and will be part of the discussion for the Men's Health seminar.
Look at their weight, look at their cholesterol, especially for men that come in with erectile dysfunction. I saw a young man this week. He was I think he's 43 years old, clearly overweight, almost, I think he told me he was 300 pounds at 43 years old, and having the symptoms of low testosterone and erectile dysfunction. And, someone needs to make it the issue, that he needs to understand that it's not the testosterone that's going to be a major life impactor for him, but his weight and his cholesterol levels. And he's at a serious risk for cardiac disease.
That's right.
Well, we'll hear from, Paul in Queens. We have just a few minutes left, but we'll take his phone call. Good morning, Paul. How are you?
Good morning. I'm tremendous. And you?
Okay, good. I'm glad you're tremendous. What can we do for you today?
Well, Dr. Stanislaw Brzezinski of Houston had a cancer survival retreat recently, and over 600 of his former patients turned up for the reunion. They were all treated by his anti-neoplastic therapy. And I'm kind of puzzled why there's many more doctors aren't adopting his protocol.
Well, what is this? I know Dr. Brzezinski down in Texas, correct?
Yeah, he had a reunion of his cancer survivors. Over 600 of his former patients, many of whom were supposedly hopeless, turned up for the reunion.
Well, I'll tell you, Paul, and thanks for your phone call. The problem with some of the doctors that are doing off-protocol thing for cancer survivors, and I'm not saying that he hasn't helped many people. Obviously, if 600 people were there, that he may have helped them. But, Philip, some of the problem with the physicians out there is, or the practicing doctors, let's say, is that they're not oncologists, let's say. They don't use standard protocols. And a lot of people coming to them because of a last-ditch effort, Now, if he had 600 people out there for a reunion, I mean, that's phenomenal. But the doctors aren't going to be using his therapies or these types of protocols, whether it be chelation therapy or antioxidant therapy or high dose of vitamins or infusions, if it's not published in medical journals. And the problem is that there's no standard protocol, so it's not going to be published, and doctors aren't going to consider it to be a standard way of treating a patient. But listen, I mean, there are people out there, holistic healers, spiritual healers. You hear about these, phenomenal things all the time, that people had end-stage disease, that there was nothing left for them, and then they went to see this physician, this practitioner, and they were cured. Can it happen? I think it can happen, It's just not... it's not going to gain acceptance until it reaches the medical community in major publications.
Yes, I mean, I definitely think there is a role for some of these treatments, but, we need to have good evidence from excellent run human clinical trials, and for many of these vitamin infusions, unfortunately, the data's not there. It doesn't mean that these things don't work, but I certainly think for many patients who want an integrative approach, the doctors that are looking at this are often very good at giving the patients time and really explaining to them about what's going on with the disease, and the patient often feels in control, feel like they're doing something with their disease. And if you find a treatment that makes you feel better, then of course you're going to want to keep on doing it. But I think we need to, as a profession, try and run trials to get the evidence to support the use of these, and unfortunately that's not often there.
Yeah, I mean, I know, my own wife has told me about this John of God. Have you ever heard of it? Have you heard of John of God down in South America, where he's a healer, and people come from all over the world, and there's some types of therapies where there's a bloodletting device. He's able to do surgery without anesthesia. I mean, major surgery. It was on the news, and I think even on 60 Minutes. But it's hard for. I mean, there may be evidence out there, and these things may be going on. It's just hard for us in the field where we're practicing medicine every day to embrace these things. When people just come in and they give these anecdotes, but they're not. How we're trained is to read published literature and used evidence-based medicine, and we need that evidence for it to be incorporated into our mainstream practice.
Well, I have a patient at the moment, a lady with a very aggressive bladder cancer, CIS of the bladder, which remains untreated for nearly 2.5 years now. She's been going to a centre in Mexico, and it's been very difficult to try and get over the message about how this really does require some important conventional treatment. But she's been in this centre in Mexico, has felt very, very supported down there, and feels so great when she is there.
Yeah.
And unfortunately, we have to remember that there is a role for both integrated and conventional, and so often patients who want this holistic approach are going to people that are not managing these kind of diseases all day, every day, and that's the problem.
And how is she doing?
Well, she still remains untreated, and it's a big problem, and it's unfortunately, I don't know where this is going to end, but I've highlighted the problems of this untreated high-risk bladder cancer. But at the end of the day, what can you do if you've educated the patient and they know how dangerous it is not to accept conventional treatment? You have to respect the wishes of the patient if they're fully informed.
Yeah, I mean, some patients are just so skeptical about modern medicine and physicians, and they have this, you want to call it a white coat syndrome, or just the whole feeling of anti-physicians and the medical community. And we know, it's frustrating for us because sometimes we'll see a patient and you know what's best for them. You know that if you just listen to me, we can take care of this. And yes, you're going to have to go through a little bit of, uncomfortableness or some side effects, but you'll get through it and you're going to be okay. And yet they wind up going elsewhere, and sometimes it's tragic.
It is tragic, and I think that this is where the role of integrative medicine can come in. And if we can merge the best of both worlds, then I think that's definitely the best way forward. And unfortunately, so many of our colleagues are very sceptical about holistic approaches. And if you are open to that and you can really try and incorporate that into your practice, it will actually help. And I see the Religion on the Line boys are hovering, and obviously they have a huge amount to offer in supporting patients as well.
I mean, religion does play a major role. I think that the whole area of mind, body, and spirit and will be, hopefully in the next few years, incorporated more into our medical practice. Well, don't forget, everyone, as we were talking, it's about a month away, so sign up for our Men's Health Seminar, and you can talk to us and meet people and get educated and have wonderful food and a wonderful day, and we hope to see you all there. That's Men's Health Seminar.
Full program is on the internet, so if you want to have a look at the program or register, you can call 516-663-9615.
Have a wonderful day, everyone. This is Dr.